I just remember in one of the videos I talked about the blood pressure. And so when you take a look at blood pressure, to me you have two different types. You have the stable type and you have the swinging type. Now, stable type of blood pressure, and check both sides, remember, blood pressure, adrenal glands on top of kidneys. That's how they come in the body, that's the influence on the blood pressure, and that's what that means. Systolic is the adrenal glands, diastolic the kidneys. If you stay steady like that, you have a steady diastolic of 95, you've got some serious kidney blockage. It makes sense, though. You're probably young to have that kind of consciousness to put yourself up like that, so that's good, but you know you're fighting some kidney and adrenals. So you would want to work with that. Your kidneys are generally going to influence the adrenals in terms of that. You're actually going to probably see some lower blood pressures. But if you're swinging, you cannot treat those with blood pressure medications. And I'm on these physicians who use these and don't take the time to find out who you are and what's going on. A swinging blood pressure, no way can you take this. No way can you control that. Same thing with swinging blood sugars. Best to live with a little higher blood sugar if you're asymptomatic than to take insulin and suddenly you wake up and now you're in the 40s or 50s. Can't do that. That game isn't worth playing. Better to play the detoxification game. That way you're directing your attention toward healing the problem. Now, swinging blood pressure, that's coming from your cerebellum here. This is lymphatic pressure. And this means your lymph system's backed up. Again, a kidney problem, but in a different way. The kidneys themselves, when they start to get inflamed and break down, that causes high diastolic, but a steady high diastolic. Consider it the pressure in your pipes. But a swinging one is coming from your cerebellum. You might notice some dizzy or equilibrium or vertigo problems as well. That would all be coming from the cerebellum. If you have no tonsils, that would even be worse. I think somewhere you mentioned maybe that would exacerbate this problem. So my guess is that it's coming from your upper spine there, your cerebellum, base of the skull. And sweetheart, you got to get your lymph moving more aggressively. Pull this out. Get those kidneys and adrenals fixed up, and you'll be in good. That'll come out of there. And if you have any genetic weaknesses in those tissues, they'll strengthen up. I would also use upper circ and probably brain and nerve just to really go in there and power up those tissues a little bit. But move those lymphs, because that's a swinging blood pressure that'll swing with stress. It'll swing with kidney cycles. It'll swing with all those 1 minute lower, 1 minute higher. That's all the lymph system, and that's the cerebellum. Medical doctors need to learn that, because you can hurt yourself with these blood pressure meds if you swing yourself into hypotension, and that's not good.